Hello, thank you for checking out our video poster here, HIV Epidemiology Update for Gay, Bisexual, and Other Men Who Have Sex with Men, which we term Gbmsm in Ontario for 2019. My name is Sean Coyler. I'm an epidemiologist at the Ontario HIV Treatment Network, and I'm presenting this on behalf of all of my co-authors listed here. Jump right in. So this was actually a fact sheet that we released this past June 2021 in support of Pride Month. We wanted to bring it to the CBRC Summit to disperse it as much as we could, and I'm happy to go through it today. Happy that you've checked out the video as well. So the first thing we did, we wanted to estimate the size of this population. How many Gbmsm are living with living in Ontario? So we used data from 2017 to 2019. So over those 3 years, we estimate there to be about 217,922. That's defined as gay identified or bisexual identified, or other men who have sex with men who do not identify as gay or bisexual, but have had a recent anal sex with another man. So that represents about 4.1% of the adult male population, adult defined as at least 15 years of age or older. And I don't want to get into the methods too much. I'm going to have a link at the end of this presentation where you can check out our full data methods blog. But just to quickly give a background on where that number came from, we got the number of gay and bisexual identified men estimated from the Canadian Community Health Survey from StatsCan, Statistics Canada. And then we made 2 adjustments to that number, one to account for non-disclosure of sexual identity to StatsCan, to the survey, and another to also include men who did not identify as gay or bisexual, but have had recent sex with another man. So with those 2 adjustments, this ended up being our estimated number for Ontario over that time period. And it certainly corroborates with other estimates with a 4.1% was not a surprise and worked out pretty well. So when we get into the surveillance data here, the first question we wanted to get at regarding testing, what percentage of tests in Ontario among males are attributed to Gbmsm? And the quick answer here is about 1 in 3. More specifically, it was about 35%, and that is where HIV exposure category is known. And we know it for just over a third, about 37% of tests, we know HIV exposure category. So we're known about 35% were Gbmsm of all tests. Which men are most likely to test positive for HIV in Ontario? So these are HIV test positivity rates. And we see the highest ones on the left here representing the Gbmsm HIV exposure categories. So these are mutually exclusive categories that are assigned by hierarchy, and they're in order from left to right here. So men who reported sex with other men and also injection drug use had by far the highest HIV test positivity rate. That's defined as the proportion of tests that come back positive. And actually that rate, 1.95%, was about 8.5 times higher than the highest non-MSM rate. That would be this 0.23 here. And then men who have sex with men but do not report injection drug use had a lower rate than that, but still higher, nearly twice as high as the next highest rate at 0.44%. So the 2 HIV exposure categories that make up the Gbmsm population had certainly substantially higher HIV test positivity rates in 2019. Moving right along, so when we look at diagnoses, what percentage of people diagnosed with HIV for the first time in Ontario were Gbmsm? From 2010 to 2019, so about the last 10 years, this ranged between about 62 and 67%. So about 6 in 10 to up to 2/3 of all people diagnosed with HIV for the first time were Gbmsm. Then we look at numbers. So what's the trend in the actual number of diagnoses attributed to Gbmsm over these same years, 2010 to 2019? We estimated about 487 in 2010, but that decreased to about 191 in 2019, kind of plateaued around 420 for a number of years here, but in 2019 decreased to 391, which is certainly a decrease and an improvement. But when we consider those numbers relative to population sizes of overall males and we calculate rates, we actually see an even more of an improvement or decrease in that the rates translate to about 7.6 diagnoses among Gbmsm per 100,000 males in 2010, down to 5.4 in 2019. So when we zoom in within Gbmsm and look at this population of Gbmsm diagnosed with HIV for the first time, one of the questions we can ask, what age group had the highest rate? And that is those 30 to 34, followed not too far behind by those 25 to 29. I just lost my, okay. And then not too far behind then them 20 to 24 and 35 to 39. So certainly higher rates in younger age groups, but are noteworthy at least rates in older age groups as well. So these are controlled for population size, what we see there. When we look at the ethno-racial distribution of first-time diagnoses among Gbmsm, over time in Ontario, how is this changing? So we see here, the first thing I want to point out, these yellow lines, they're not just eyeballed, they actually represent linear regressions. So we looked at these numbers over these 6 years, 2014 and 2019, to see how they're changing over time. What we can say, white Gbmsm made up the largest number, clearly here the highest bars here, of first-time diagnoses among Gbmsm between 2014 and 2019. And the number of white Gbmsm diagnosed with HIV for the first time has decreased over time. So this decreased yellow line was the one that was statistically significant. So we can say that the number of diagnoses among white Gbmsm is decreasing. Trends in first-time diagnoses among Gbmsm of color are less clear. What we can say here is that they're not increasing or decreasing, at least not statistically significantly so. So where we can say they're just decreasing for white Gbmsm, we're not able to say the same among for Gbmsm of all other race ethnicities. I also wanted to point out there were some decent numbers here of diagnoses among Gbmsm that did not have a race or ethnicity reported. And certainly some suggestion that of an increase in number among especially Latin American Gbmsm and potentially Black Gbmsm as well. When we look at geography and kind of zero in on Ontario and especially Southern Ontario here, so what this is not is all the diagnoses across the regions of Ontario. Instead, we look within each region and ask what proportion of diagnoses, first-time diagnoses in this region were attributed to Gbmsm. So Eastern region had, in 2019, Eastern region had the largest proportion of its HIV diagnoses among males that was attributed to Gbmsm. So 83% of all males diagnosed with HIV for the first time in Eastern region, which includes Kingston, were Gbmsm. Followed by Toronto at 81%, Northern region at 71%, Central West region, which includes Kitchener-Waterloo, Guelph, Hamilton, and Niagara region at 67%, Southwest region, which includes London's Sarnia and Windsor at 59%, Ottawa at 57%, and Central East region, which includes Peel, York region, and Durham region. At only 39% of all males diagnosed with HIV the first time there were Gbmsm. And then lastly, what is the prevalence of diagnosed HIV? So it's important to note here, this does not include Gbmsm living with HIV that have not yet been diagnosed. What is the prevalence of diagnosed HIV among Gbmsm in Ontario? So we estimate there to be 10,909 Gbmsm diagnosed with HIV in Ontario in 2018. When we divide that by our earlier number, the population size 217,922, we get a prevalence of 5.0% of diagnosed HIV among Gbmsm in Ontario in 2018. Most Gbmsm living with HIV are on ART, and when they are, they achieve high levels of viral suppression. We have a full page here of footnotes, which is all available in the fact sheet at this website. You can email me as well. And OEASY is a collaboration between the Ministry of Health, Public Health Ontario, Ontario HIV Treatment Network, where I work, and Public Health Agency of Canada. Thank you.